Hello, this is Ronald van Vollenhoven, Editor-in-Chief of Lupus Science and Medicine, reporting from the EULAR Digital Congress, the web-based EULAR Congress for the first time this year. Very, very different, very exciting because there are lots of possibilities. We can hear all the scientific presentations and look at the scientific posters, all from the comfort of our own office. But of course, we do miss the meeting of people and the atmosphere. Nevertheless, today I saw some very interesting things. I was especially interested in a presentation by Professor Johan Frostegård from Sweden. His presentation was entitled IgG1 antibodies against phosphorylcholine are negatively associated with disease activity, disease damage, cardiovascular disease, and atherosclerosis in SLE. Actually, it even continues, a long title, but the bottom line is that Johan Frostegård and his colleagues over many years have actually shown that antibodies against phosphorylcholine exist in the healthy individual. They are antibodies that we all have. They're naturally occurring antibodies. And that's a little bit odd because phosphorylcholine is one of the key molecules that make up the cell membrane. And so we actually do have antibodies against something that we also have. They are sort of autoantibodies, but at the same time, they seem to actually have beneficial effects. And this was also Professor Frostegård's message today, that in lupus, they are actually associated with low disease activity. So the patients who have these antibodies, and of course in lupus patients have many autoantibodies, but the patients with these antibodies, they actually have lower disease activity, they have less damage, and also their cardiovascular disease and progression of atherosclerosis is less. So it is good to have these particular antibodies, and they are certainly going to have to be studied a lot more to know if that could also be used therapeutically. At the same time, this actually really reminded me of a publication that I read not too long ago by a former colleague, I believe, of Professor Johan Frostegård. Not 100% sure, but I do believe she was Dr. Sofia Ayaguanova, who then actually worked in the Netherlands. And she published a paper in Lupus Science and Medicine showing a bit of good news in the sense that patients with mild lupus, if they had arteriosclerosis, which of course many patients do have, but it did not progress more than it would in the general population. So the progression of the arteriosclerosis was not worse. And that was certainly a little bit of good news for patients with lupus. Still, the corticosteroids in that situation are a risk factor. So that still remains something that's on the minds of the lupus physicians to try to find ways of minimizing steroids. Well, anyway, interesting stuff here at the EULAR Congress. I hope you get a chance to enjoy some of it as well. Have a great day. Thank you.